Welcome to Last Breath Diaries. Thank you for joining me this evening. Before we dive into tonight's story, pour yourself a drink, sink into your favorite spot on the couch, let the world fade away, take a deep breath, get comfortable, and settle in. Tonight, we step into the shadows and into the story. Welcome back to Last Breath Diaries. When we last left off, 42-year-old Janice Kelly's life had taken a terrifying turn. What started as chest pain dismissed as anxiety had escalated to cardiac arrest right inside the emergency department. But what happened next and what followed her into the cath lab would expose just how fragile the line between survival and silence really is. When the code team revived Janice, her pulse returned weak and thready. Her body was drenched in sweat, skin pale, lips blue-tinged. Within seconds, the cardiologist called it. "We're going to the cath lab, now." The doors burst open, and her gurney rolled through the corridor like a bullet. Nurses pushed IV poles beside her, monitors clattering, oxygen hissing through the mask over her face. You could hear the wheels echoing down the sterile hallway, that distinct metallic sound that always means life is hanging by a thread. The cardiac catheterization lab is a world of its own, quiet, focused, cold enough to bite through your scrubs. Lights hover above the patient like unblinking eyes. The air hums with machinery and urgency. Janice was transferred to the narrow procedure table, her arms strapped gently at her sides. A sterile blue drape was placed over her chest. Monitors beeped with uneven rhythm as the interventional cardiologist inserted a catheter into her right femoral artery. Through that single slender line, they navigated a wire up toward her heart, a path shown only by the glow of contrast dye and the black and white flicker of fluoroscopy screens. And then, there it was, a complete blockage, the left anterior descending artery, often called the widowmaker. The cardiologist muttered under his breath, "Severe occlusion, no distal flow." Time was muscle. Every second that artery stayed blocked, more of her heart died. They advanced the guide wire, inflated a balloon, and placed a stent, a tiny metal scaffold, to reopen the vessel. The screen showed a brief flicker of triumph as blood began to move again, but victory came late. The damage was already catastrophic. Janice's heart rhythm destabilized, slipping back into ventricular fibrillation, a chaotic storm of electrical impulses. The team moved fast. "Start compressions. Charge to 200. Clear." Her body jolted against the table, once, twice, then a flicker on the screen. A rhythm returned, faint but present. For now, she had a pulse. But the fight was far from over. "Hey, nurse chap, let's break this down for a moment. When someone goes to the cath lab for a heart attack, it means there's a blockage in one or more coronary arteries, the vessels that supply blood to the heart muscle itself. The goal is to revascularize, basically open that blockage so blood can flow again. The most common method is angioplasty with stent placement, just like Janice had. But here's the catch. When too much time passes before that artery is opened, the muscle downstream starts dying. Even if the artery is cleared, the heart's ability to pump can be permanently weakened. That's when patients spiral into something called cardiogenic shock. The body's organs start to fail because the heart can't deliver enough blood to keep them alive. Janice was transferred to the cardiac ICU immediately after the procedure. She was sedated, intubated, and connected to machines that blinked, beeped, and breathed for her. Her chest rose and fell mechanically, and every few minutes, the ventilator made a soft sigh, a haunting rhythm that filled the room like a heartbeat borrowed from a machine. She was alive, but barely. Her heart's ejection fraction, the amount of blood her heart could pump out with each beat, was down to 15%. That's less than 1/3 of what it should be. Her kidneys were shutting down. Her blood pressure kept dropping, forcing doctors to start powerful medications like norepinephrine and dopamine just to keep her organs perfused. Her daughter Maya arrived later that night, still in disbelief. She stood just outside the glass doors, frozen. She couldn't bring herself to go in at first. Inside, her mother looked nothing like the woman she'd hugged that morning. When she finally stepped closer, the machine's rhythmic beeps filled the silence. Maya took her mother's cold hand in hers and whispered, "Mom, please, don't leave me yet." There was no response, just the constant sound of the ventilator. Nurses adjusted IV lines, titrated drips, wiped tears they didn't have time to shed. Every few minutes, someone checked her pupils, her pulse, her oxygen levels, hoping for improvement that never came. Hours passed. The night deepened. Then a sharp alarm pierced the quiet. Her heart rate spiked, then plummeted. Another code. This time in the ICU. Doctors and nurses flooded the room again. Chest compressions, medications, another round of defibrillation. The scene mirrored the earlier chaos, but this time the exhaustion was palpable. After 12 minutes, a weak rhythm returned. Again, she had a pulse, but each resuscitation came at a cost. Her body was breaking under the weight of survival. When the monitors finally settled, a doctor turned to Maya with eyes that said what words couldn't. "She's critical," he said softly. "We've done everything we can." Hey, nurse chat, let's pause again. When a patient like Janice codes more than once in a short time, every organ suffers. The brain, especially, is sensitive to oxygen deprivation. Even brief moments without adequate oxygen can cause irreversible brain injury. So when doctors say we've done all we can, it doesn't mean they're giving up. It means the body has reached a point where medicine can't fix what time and damage have already destroyed. Morning crept in slowly, spilling pale light across the ICU floor. The chaos had faded, replaced by sterile calm, the kind that feels too quiet, too final. Janice's numbers were dropping, blood pressure unreadable without medication, kidneys unresponsive. Her brain activity diminished to almost nothing. Maya sat beside her again, staring at the woman who once called her every morning, who laughed too loud, who carried the world on her back. Now she was still, a body kept alive by tubes, drips, and machines. When the doctors came in for the family conference, Maya already knew what they would say. They explained that her mother's heart was beyond repair and her brain had suffered irreversible damage. They told her there was no meaningful recovery possible. The decision was hers. She sat there for hours, just holding her mother's hand. No tears, no words, just quiet. When she finally stood, she whispered, "It's okay, Mom. I'll be okay. You can rest now." She nodded to the nurse. The ventilator was silenced. The monitor slowed, then flatlined. And just like that, the sound that once kept her alive became the sound that marked her end. But this isn't where Janice's story ends, because in the days that followed, her daughter would uncover something inside her mother's medical chart, something that proved Janice's death didn't have to happen. And when she found it, it changed everything. To be continued. Before you go, let me ask you 3 questions. 1. Do you think Janice's heart attack could have been prevented if her pain had been taken seriously the first time? 2. Should hospitals be held accountable when patients like her are dismissed or misdiagnosed? 3. What would you do if you discovered your loved one's death could have been avoided? Thank you for watching Last Breath Diaries. Don't forget to like, share, comment, and subscribe. And be sure to turn on your notification bell so you don't miss a single episode.